Hello, everyone, and welcome to Nursing 200 Nursing Fundamentals course. My name is Debbie Gittens, and I will be doing a vital signs teaching episode. So when you think about vital signs, what comes to mind? Vital signs reflect the function of three body processes essential for life: the regulation of body temperature, breathing, and heart function. Vital sign measurements of body functions are temperature, pulse, respirations, blood pressure, and some of you may not be too familiar, but there are two added measurements that most facilities are now using as part of assessing vital signs, and they include the pulse oximetry and pain. Measuring and reporting vital signs. Vital signs are measured to detect changes in normal body function. They represent responses to treatment, such as pain management and medication administration, particularly with blood pressure management. Part of the assessments, vital signs are also part of the assessment step in the nursing process. Vital signs are taken usually during a physical examination and before or after complex procedures, usually to determine if there are any extreme changes um, in the based on the procedures or treatments or interventions that were performed. And vital signs are done when a patient or a client is admitted to a healthcare facility and as often as the person's condition requires. We take vital signs with a person at rest when they are lying down or sitting, unless otherwise ordered. And we report the following: any vital sign that has changed from prior measurements, and vital signs that are above or below the normal range. Now we will get into the specifics of different vital signs measurements. Body temperature. Body temperature is a balance between the amount of heat produced and the amount lost by the body. Thermometers are used to measure temperature. The two scales that are used to measure a temperature is Fahrenheit, represented by the F, and Celsius, which is represented with a C. Normal ranges for an average adult is 98.6 degrees Fahrenheit to 100.4 degrees Fahrenheit, or 36 degrees to 38 degrees Celsius. Familiar temperature sites include the oral route, rectal, axillary, which is underarm, tympanic membrane, which is in the ear, and the temporal artery, which is on the forehead. The types of thermometers that are used is the glass thermometer, which I have displayed here, which these are not as common as they used to be because of they can be easily broken, and it's dangerous because of the mercury that is inside of them, used to measure the temperature, the actual temperature, and because it's glass. Okay, the standard electronic ones are the more familiar ones now and the more popular ones. This is the tympanic membrane one, which I show here in a picture representation. And this is a child with a tympanic thermometer going into the ear. And the temporal artery thermometer, which is being measured on the forehead. The other two thermometers that are used now is the digital thermometer, which can be used via the oral route, the axillary route, or the rectal route. And as you can see here, it has the digital display here, and this the end of the probe here is where it would either go orally, axillary, which is under the arm, and rectally. There's also if you're using this for more than one person, you would actually have to have the probe covered, which makes it usable with multiple people, or even with one person. It's more sanitary if you use a probe cover, which can be disposed of. The other one here is specific to infants, and it's the pacifier thermometer. Because we know all infants, or at least most of them in their young stages, like pacifiers, this pacifier thermometer, of course, would be easily used with the infants, because they would think it's a regular pacifier, and would be agreeable to put it in their mouth, and of course then it would be taking their temperature while soothing them at the same time. Okay, next we will move on to pulse, otherwise known as a heart rate. A pulse is felt every time the heart beats, and it signifies the number of heartbeats or pulses felt in 1 minute. A stethoscope is an instrument used to listen to the sounds produced by the heart, lungs, and other body organs. But for this specific topic with the heart rate and the pulse, the stethoscope is used to listen to more than likely the apical pulse. So that's where you would put the stethoscope diaphragm directly over the heart area to listen to the apical pulse. Pulse sites are the temporal, the carotid, brachial, radial, femoral, popliteal, posterior tibial, dorsal pedis is also the last one. The apical pulse, as I mentioned, is felt or heard over the heart. An adult pulse rate is between 60 to 100 beats per minute, and a radial pulse is the most frequently used for routine vital signs. I will shortly show you a diagram, and here it is, of the different pulse sites. And as I said, the temporal is located here just over the temporal area above the ear. The carotid is on the side of the neck below the ear. The femoral is felt in your groin area above the femoral area. The brachial, of course, is in your brachial area. It's close to your elbow joint. Okay, and the popliteal is behind your knees. Radial is on your wrist, and it's on the thumb side of your wrist. The posterior tibial is on the side of your your feet, and the dorsalis pedis is on top of your foot. Now, these are the different pulse sites. Respirations. Respirations is defined as the breathing of air into and out of the lungs. Inhalation is described as breathing in air, and exhalation is breathing out. Oxygen enters the lungs during inhalation, and during this process you will see the chest rise. Carbon dioxide leaves the lungs during exhalation, and with this you will see the chest fall. Respiratory rate is the number of respirations per minute, and an adult normal range you will see is between 12 and 20 breaths per minute. With a child, it will be between 16 to 20 breaths per minute, and an infant, it will be 30 to 50 breaths per minute. You count respirations when the person is at rest and position them so that you can see when the chest rises and falls. And it is also a good habit not to necessarily let them know that you're actually counting respirations, because it can alter their breathing and then alter what the normal respirations are. Blood pressure. Blood pressure is the amount of force exerted against the walls of the artery by the blood. The systolic pressure is the pressure in the arteries when the heart contracts. The diastolic pressure is the pressure in the artery when the heart is at rest. Blood pressure is measured in millimeters of mercury, and the systolic pressure is recorded over the diastolic pressure. So that's how you would when you have to record it, you record the systolic and then you record the diastolic under the systolic. Blood pressure has normal ranges. The systolic normal range is 90 or higher, but lower than 120 millimeters of mercury. And the diastolic pressure normal ranges is 60 or higher, but lower than 80. The World Health Organization guidelines recommend that the blood pressure should be measured in the sitting or supine position. And the American Heart Association considers normal blood pressure reading to be below 120/80. So 120, like I said, would be the systolic pressure, and 80 would be the diastolic pressure. A stethoscope and a sphygmomanometer are used to measure blood pressure. Now you see how difficult that word is to say. Sphygmomanometer. Here I am showing you pictures of, this is the stethoscope, and this is the sphygmomanometer, and this is what you would use. The two in combination is what you would use to take a manual blood pressure. The picture on the bottom left is a picture of a wrist device that is used to measure blood pressure, and the picture on the right is it's a device that's used to measure, it's a digital, to measure blood pressure, but it's a digital device. Okay, so the manual one would be the stethoscope and the sphygmomanometer on the top in combination, and the two bottom pictures, the left one is the wrist, a digital wrist device, and the bottom right is a digital, regular digital for your upper arm area. Now we will move on to a pulse oximetry. The pulse oximetry measures the oxygen concentration in your arterial blood. The normal range is between 95 to 100, and the sensor attaches to a finger, either your finger, toe, earlobe, nose, or forehead. The most common is to attach it to your finger, and here I am demonstrating the finger with the pulse oximeter attached, and it shows you that this person's pulse oximetry reading is at 98%. And like I said, the normal range is between 95 to 100%. Okay, the final vital signs that we will be discussing here is pain. Pain is a warning sign from the body, basically telling you that something may be wrong in the body's function, and it can signal tissue death. So it is considered a very important vital sign measurement along with all the others. To measure pain, most facilities now are using the pain scale, and it's a way to measure and assess a person's pain. Here I have a picture of a pain scale, the Universal Pain Assessment Tool, and it's basically a facial expression scale that's showing you a regular smiley face would represent either no pain or at least very little or minor pain discomfort. And as it progresses to the higher numbers, of course, the pain is progressively worsening. Okay, here I just have it in a word form. So here, mild pain would be represented with the numerals 1, 2, or 3, either pain-free, very minor, or minor annoyance, a minor annoyance, 1 to 3. Moderate pain will be between 4 and like maybe 5 or 6. So that would be in the middle range of this, the left scale. 4, 5, or 6 is moderate pain. And then the more severe would be 7, 8, 9, and 10 would be a more severe pain. Here in 7, it says makes it difficult to concentrate. 8 would be where physical activity is almost impossible or very limited. unable to speak, cry, or cry out, or if the patient is moaning in pain, that would be in the severe range. So that would be around 8 or 9. And 10, they say unconscious or pain makes you pass out. So that's severe if you're really passing. In conclusion, I would just like to highlight a few important points on vital signs. Vital signs are used to determine usual state of a usual state of health, to determine usual state of health and baseline status of a patient. It is also used to show changes in the health status, whereas variations from normal may indicate a possible problem. The data gathered from vital signs is used to identify nursing diagnosis, clinical problems, and for you to be able to select nursing interventions. Vital signs determine effects of treatment. So if you are giving a patient a treatment such as a medication or any kind of therapeutic treatment, taking vital signs before and after can help you determine if the intervention is a positive one. The guidelines for vital signs would be to gather your proper equipment for whichever vital signs you're taking, or if you're taking all together, you make sure you have all the proper equipment with you when you enter the patient's room. You instruct the patient on what you're going to do, which vital signs you're going to do, and what's actually involved in taking the vital signs so they know what to expect. You know the patient's usual range, so you should gather data before you actually go in to take their vital signs on what their normal ranges are and some of their medical history. And then you try to control some of the environmental factors around that patient when you're taking their vital signs. Okay, so you try to minimize the noise. You um, you try to assess the temperature of the room. So if you have to maybe move the patient or move the sheets or the blanket or whatever, you try to control whatever the environment is for that patient at that time. And then you, of course, one of the important things too is, yes, you're going to take the vital signs, but what are you going to do with it after you take it? So you have to record the vital signs on wherever the acceptable location is that the vital sign gets recorded for your facility, and you report any abnormal findings or anything outside of that patient's normal range so that proper interventions can be ordered for that patient. And thank you very much for listening to my vital signs presentation.